That is a very, very proud customer of AWS, really leveraging the AWS-Cloud to save lives. And how are we doing that? We're doing that by making healthcare accessible. So let me begin by asking you, how many of you have access to expert healthcare? We're in Israel. You all have access to expert healthcare. You call your pupa and you can access expert healthcare. But around the world, 5.8 billion people cannot access expert care. And we as a company decided to start doing something about this. Said, okay, 5.8 billion people, that's a huge number. They don't have access to expert care, but they do have access to what? Midwives, nurses, community health workers, and in terms of technology, mobile phones, smartphones, in all parts of the world. So that's when we started thinking, how can we leverage this existing technology with the existing healthcare infrastructure in order to really have an impact? So we started focusing in on a specific area of healthcare. How many of you are familiar with cervical cancer? Okay, cervical cancer is the fourth most common cancer for women around the world. When you look at low resource settings, it's generally the first or the second most common cancer, and the first or the second cause of cancer deaths amongst women. And the most tragic thing about this is that cervical cancer is a cancer that is incredibly easy to detect, and if it's caught in the first 5 years, can be treated in under 10 minutes for under $10. So no woman should be dying from cervical cancer. So what's happening? Almost 1 billion women around the world need to be screened every year for this disease. But only 10% of them have access to screening. This results in the death of over 250,000 women annually for a disease that is so easy to treat if it's caught early. And for those of you that think this is only affecting Africa, Southeast Asia, developing countries, this is a map of the United States. And if you look at the red dots, those are pockets in the United States that lack access to an expert gynecologist. And why is that important for cervical cancer? Because if you look at the existing technology, this is what you need in order to have advanced care for cervical cancer. It's large, it's bulky, it's office-bound, it's extremely expensive, and it requires an expert to operate it. So our company decided to create the absolute equivalent in a handheld form, because we really believe that you can leverage the infrastructure that exists in healthcare, mobile technology, and the cloud services in order to provide that same level of expertise to anyone, anywhere, using technology. And this is how it works. So we have a small handheld medical device with equivalent optics to what you saw in the previous slide, light, battery powered, and the best part is that it's as easy to use as WhatsApp. So that means a nurse in Western Kenya who's using WhatsApp regularly but doesn't necessarily have the expertise to conduct expert-level cervical cancer screening can now use our mobile app and leverage the AWS Cloud servers in order to access our online portal to be able to get remote consultation, quality assurance, and to have a conversation back and forth with experts in Houston's MD Anderson Cancer Care, the best cancer center in the world. And all this is enabled using the AWS Cloud. And when we're looking at ministries of health and higher level programs, large hospital networks, all of the information is automatically stored using the cloud and analyzed so that they're able to look at the statistics. They can see how many women have been screened, in which regions, what kind of treatment they've sought, so that we can have a better sense of policy decision makers as to where to begin introducing new training, new forms of treatment, and really help them save money as well and have a greater impact. To date, we've used our technology in 26 countries around the world and have screened over 16,000 women. Since our establishment in 2012, our product came out in 2015, we screened 16,000 women around the world. And it's been absolutely fascinating using the AWS Global Reach to be able to see exactly how many women are being screened, what the abnormality rates look like in parts of the world that previously didn't have this kind of information. I'll give you one quick example. A couple summers ago, we ran a medical screening camp together with the government of Kenya in Nairobi. It was the first time the Ministry of Health was able to screen women and in real time count the number of women that were being screened and treated and with what form of treatment. And you have this information that was helping the Ministry of Health. And with this, we're just getting started. Oftentimes I'm asked, why only women's health? Why only cervical cancer? That's where we saw the opportunity to have the greatest impact as quickly as possible. But we're just getting started. After this, we're going to be looking at oral cancer, a larger database for patient tracking, sending SMSs back and forth, ear, nose, throat, eyes, skin, larger cancer registries. And in parallel to all of this, we're developing machine learning algorithms to be able to implement them at the point of care to have risk assessment. So if you're interested in learning more, we're currently hiring. We're looking for developers, sales representatives, and marketing. And if you'd like to join us on our mission, please come speak to me. Thank you.